Sit down.
Okay, we are live 10 seconds ago.
Let me get the PowerPoint up. Good evening, and we are once again back for our COVID conversations in the Black community. At our last session, we dealt with the ladies. Today, we are focused on the men, and we have several great panelists today. I think we're in for a great show. So before we begin, I just want to give a brief overview about today's show. So again, we're talking about the impact of COVID-19 on men of color. And the moderators, as usual, are myself, Dr. Allison Myers, and my co-moderator, Dr. Maya Williams. And right now we're dealing with a time of having to wear a mask outside, which can be very frustrating. I know this has been a problem for me where I've gone out of the house and walked down the hall and gone outside and realized, oops, I forgot my mask. But obviously masks are what's keeping us safe. So it's really crucial for all of us to continue to wear our masks if we cannot social distance. Unfortunately, the cases of COVID have continued to rise in this country. Now more than 4 million people in the US are living with COVID. And unfortunately, it's disproportionately affecting communities of color. As of July 22nd, 2020, it should be noted that we've lost at least 28,856 Black lives to COVID-19. Many of them, of course, here in New York City. In addition, COVID-19 has continued to impact our communities more, and in our men especially, there's concern that our men are dying more than compared to white men. So in fact, they were twice as likely to die. And on top of that, our men are dealing with issues in terms of racism and police injustice. Why are all these things happening in our society? Well, we already know that in healthcare, there are a lot of racial disparities that are already existing. We can look at the percentage of the number of physicians of color. Only 5% of the physician workforce is Black. And so, of course, that's going to make a difference in terms of outcomes in healthcare for our people of color. Black men are a greater risk for diabetes, twice as much than compared to white men, also more likely to have heart disease. And the amount of our men who are dying prematurely of heart disease is twice as likely. So issues such as poverty, racism, past trauma have been contributing to not only the physical, but also the mental health of our men in our community. And unfortunately, African-American men have death rates that are at least twice as high as those for women in terms of suicide, cirrhosis of the liver, or homicide. And unfortunately, our men sit in silence when it comes to dealing with mental illness. Approximately 7% of African-American men will develop depression during their lifetime. So this also stems from the fact that we have something called toxic masculinity, in which we teach our men that this is what it takes to be a man. Be strong. Don't talk about your feelings. Get through it on your own. So today we're going to talk about these topics. We would like to thank our co-sponsor from the community, the Black Educators Committee. Shout out to my soror, Vashti Burke, who facilitated this connection. Also like to thank Dr. Naomi Maria, who is live streaming with us from Curacao. We also like to thank Tiffany Harvin, the Department of Medicine at Northwell, as well as the CHIOR. So today we're in for a treat. We have 3 wonderful panelists that will be here to address the topic of Black men's health in these times. We first have Brian Kolar, who has a master's and is now currently a PhD candidate. He is a clinical community psychologist in urban education and policy, joining us from Chicago. We also have Dr. Eve Dorisseau, who is the chair of the emergency department at Lenox Hill Hospital, which is a part of Northwell Health here in Manhattan. And last but not least, we have our assemblyman from the 33rd District, lawyer, JD Clyde Vanell, who is also here joining us today. So we are definitely in for a treat, and I'm going to turn this over to Maya to get us started. Thanks, Dr. Williams.
Thank you, Dr. Myers. I'd first like to ask the question to Dr. DeRosa, who's had face-to-face contact with individuals with COVID in the emergency department. Dr. DeRosa, could you tell us how safe are hospitals currently? People have been scared to go to the emergency department out of fear of getting COVID-19. What would you recommend? What has been your experiences and what would you recommend?
Well, thank you for that question. Interestingly enough, I did write a op-ed piece that was published in the Wall Street Journal just about this topic. And I think, to your point, folks are fearful of coming to the emergency department and they fear that they will contract COVID-19. But the unfortunate news related to that is that folks are dying at home of heart attacks, of strokes. We've seen at the peak of COVID, a 40% decline in folks coming in with the chief complaint of chest pain. We've seen a decline in patients coming in with symptoms of stroke. And this is detrimental, more so in our community, minorities who already have extensive underlying disease. So the message I would say very strongly is emergencies are still emergencies. The emergency departments are safer than they've ever been. Actually, I would suggest they're safer than they were before COVID. We're taking temperatures of all patients who are coming in, and we're also taking temperatures of the staff, and we're taking temperatures of visitors. So from that standpoint, there's already a screening. Every patient who enters has to wear a mask. Everyone who's taking care of the patient is also wearing full N95, full protective gear. And all the staff is undergoing extensive hand hygiene. We're sterilizing the place after every use of beds in the areas. So the emergency departments, and this is throughout the city, are safer or cleaner than they ever been. So the risk of transmission of COVID from one patient to another is pretty rare. Before we had a handle on COVID, yes, there was about 11 to 15% transmission. That has significantly deteriorated pretty much to be insignificant. The other thing, at least I could say for New York, I can't say that for other states, the prevalence of COVID is actually very, very low. At this point, we're seeing about a 1% prevalence in New York City. So again, if you have an emergency, if you have chest pain, if you have symptoms of stroke, if you have any true emergency, it's critically important that you come to the emergency department as soon as possible, and we will keep you safe.
Thank you for that, for putting our fears at bay. At the beginning of the conversation, at the beginning of when you started talking, you said that a majority of people are dying at home as well. And this question is for Assemblyman Clive. We know that we Black Americans or Black people are fighting two pandemics, which is COVID and racism. What do you think can be done by governments, local officials, organizations, and businesses as a whole to help stop the spread and disproportionate effects of both pandemics in the Black community?
Wow, that's a very big, tough, broad question. And I wish I had the magic wand to solve COVID, which the world is dealing with, but racism. One of the things that's important, I think, for us when we talk about and we look at how COVID has disproportionately affected the minority communities, the Black, brown communities, or what have you, and how health, how we have certain health disparities. One of the things I want to be mindful is that when phenomena that comes and affects everyone, people at the bottom get affected the worst, no matter what it is. So it is a shame that if you look at this past political cycle, when there were 27 Democrats running for president, each of them knew a fact that was really bad for us. They knew that Black people in this country as a whole were worth less than everyone else. That's not good. They also knew that, and they could all recite this. They also knew that by 2050, we'd be worth even less as a people. They also said that, they also knew that people that come to this country just cut to this country, their generations would be ahead of us. So when we look at, and then also we have to be careful of saying that, your race or your ethnicity doesn't necessarily it mean a determining factor of how that disease is going to deal with you. It's socioeconomic, right? So a Black person, a Caribbean person, or what have you, from a certain socioeconomic background is differently affected by coronavirus and these other kinds of diseases than not. So as a policymaker, what do we look at? I think that what's very important is that I don't think policy, we have to deal with the emergencies and we have to make sure that we take care of the folks in the emergency situation. But it'd be a shame if we have the same conversation a generation from now and we're still at the bottom. As a policymaker, I have to make sure, how do we get us to build wealth? How do we get us up the socioeconomic ladder? And look, I'm not a doctor. Actually, one of my sisters is a doctor. I think you're a hospital, Dr. Russo. I think she was there. But how do we, folks have told me that, when you guys are in health, the healthcare is different for people from certain socioeconomic backgrounds. So so I don't want to make it more comfortable for us on the bottom. And we have to make it better at the bottom, but the fact is it's very important for us to get out of the bottom. So how do we do that? And we can talk much more about that, but that's very important. And when it comes to racism as a society, George Floyd, in the process of him getting killed, he got, the process during that time, it was because of a supposed counterfeit $20 bill. Eric Garner selling Lucy's. On and on and on. We're talking economic situations or what have you, where, and I'm not, there's no way that I'm justifying those deaths, but we cannot continuously be, to be at the bottom economically, and we have to make sure we focus on getting us up the socioeconomic ladder.
Dr. Williams, you're on mute.
Thank you, Dr. Myers. I apologize. Feels like I'm in one of our team meetings where I'm always on mute. But Assemblyman Clive spoke about, racism and building generational wealth. And Eric Garner was from New York City, and he died from, just selling cigarettes on the sidewalk. And we had George Floyd, who died allegedly for a counterfeit $20 bill. And Black people have been having to deal with a lot, whether that be trauma from racism, enslavement, oppression, segregation, you name it, we deal with it in the workplace, on the streets, wherever we go, we constantly have to deal with this. And there's a lot of research that's saying that this trauma is very impactful to our, not only our mental health, but our physical health as well. So I would like to ask Brian, in light of the mental health being a taboo subject in the Black and Brown communities, what can Black men do specifically during this time to protect their mental health and those of future generations? Because most times Black men are the ones suffering in silence without saying anything about it.
Okay, great. So thank you for that question, ma'am. So I think that it's important to state a couple things, right? I think that it's important to state that the intergenerational trauma can be passed down, right? And research shows that. And COVID mixed with racism, anti-Blackness, right, really just kind of exacerbates some of the things that we already deal with and struggle day to day with or struggle through. So I think that it's important to state that we've always been the most vulnerable and the most targeted, right? But also we've always been the most capable as well, right? So Fannie Lou Hamer says that, we were forced into slavery, that we never wanted it, and that we always resisted and refused it, right? So in thinking about that, it's important that we also build spaces, create spaces where we are refusing this one thing, but also doing something else, right? So like building spaces of joy, of renewal, of spaces that affirm you, right? Spaces that challenge you but affirm you. So, and that's an important distinction, right? But like also though, I think that it's important that we also discuss how like racism, anti-blackness targets Black people, but Black men in a particular way that seeks to isolate us and then injure us through our isolation. So like in these times specifically, right? I think that it's important that we find ways to connect with loved ones, that we find ways to do things that take our mind, take our body from the conundrum of anti-blackness, but also COVID in this time. Right. Yeah. So my thoughts. Thank you for that.
I do agree with that we need to come together as a family and take time out to just recognize our Blackness. But one of the things that we usually face is implicit bias and stereotypes, which have been known to contribute to health disparities, especially in Black men. There is research that says that Black men do so much better when they're seen by Black doctors. Preventative care, treatment, doing invasive and non-invasive procedures, they do so much better because of the culture between two Black men. Yet, we know that in 2013, only 5% of Black men were enrolled in medical school, a decline from 57% in 1986. So Dr. DeRosa, what can Black men do to advocate for themselves when visiting the doctor during this pandemic and in the future, particularly when the doctor does not look like them? And what can physicians do to address the implicit biases?
So again, a lot of heavy questions here, but very good questions. And I thank my fellow panelists for some of the things that they've raised, because I think it ties into this question. So there's so many ways to answer this question, but one of the things I think is very poignant is that 20% of healthcare involves your interaction with hospitals, your interaction with the doctor. 80% of your healthcare really happens in the communities that you live in. If you just think about it, you don't spend that much time in front of a doctor, you don't spend that much time in the hospital, but you spend a lot of time in your neighborhood, you spend a lot of time in your churches, you spend a lot of time in your schools. And where is that support for you in your community? And that's where it all starts. What are you learning in your schools? What are you learning in your churches? What are you learning from your neighbors in your community? And who are you role modeling from? And so all of these things start at a very early age. If you don't have food security, if you don't have shelter, if you don't have good spiritual guidance, this is where things break down and your health suffers. So, these are the root causes of the issues that we're dealing with that we have to address. But I will let the assemblymen do that. That's bigger work. But for me, I would say to answer the question specifically, having an advocate, there's nothing better. And for men, it tends to be a woman. It tends to be your partner, it tends to be your mother. We found this over and over. Women tend to be the ones who drive the care of men. And so I would say, if you have a man in your life, be it a friend, a cousin, check in on them. Ask them when's the last time they saw a doctor. Ask them if they're 40, did they get their prostate check? If they're 50, they have a colonoscopy. How's their blood pressure? How's their day? We don't have those conversations. I have those conversations with my friends. And I think we need to start to have more of those conversations in the community. How often are you exercising? I'm not here to promote any religion. As a matter of fact, I don't necessarily, but I think the spirituality is important for some people, or some kind of way of dealing with stress. For me, it's through exercise, be it swimming, running, biking. That's where I find my peace. That's where I get to clear my mind. So I think it's more of a holistic approach to health that I think we need more and more in our communities, and it's lacking severely.
All right, thank you. I think you raised some a very valid questions. We have one more question for you. I'd like Dr. Myers to go ahead and ask the question.
So we have a question from the live chat, and I will pose this to you, the good doctor. The question is, do we understand why so many people are dying at home from or suffering from stroke, and are men more at risk?
Yeah, so there is a fear. There is a fear of coming to the hospital. There's a fear of interacting, even before COVID, there's been a fear of interacting with the healthcare system. Depending on where you live, also dictates the level of care. If you're not part of a good hospital system, depending on what door you walk in the United States of America, the care is very different. And that's unfortunate, and we need to address that. So I'll give you an example for COVID. We saw a lot, the epicenter of this epidemic was actually in Queens. And there were a lot of reasons for that. We told people to shelter in place. It was a good message for COVID, but think about it. Where are you sheltering in place? If you're sheltering, if there's 6 people in an efficiency, that doesn't help. And if one of those or 2 of those people have to work because they're essential workers, or they're delivering groceries, or they're a nurse, and we saw this over and over in Queens. People would go out, they'd come to the home, and the entire family would have COVID and come to the hospital. So that message, while it was good for COVID, wasn't necessarily good for our communities. And then if you look at Lenox Hill, where I work in the Upper East Side, what was happening here? Folks were going to the Hamptons. They were going to Connecticut. They were going to big homes. They were going to outdoor areas. And they weren't as afflicted. So that goes back to what I was saying about where you live, your resources, your support impacts your health. And so this shelter in place message got translated to, I'm not going to the hospital no matter what, because I'm going to get COVID. And we have to re-message that. We have to re-message that emergencies are still truly emergencies.
Thank you. Earlier, you raised a very valid point that a lot of the onus is not on healthcare providers at times. Sometimes it's on the policymakers, like Dr. Assemblyman tried. Sorry to put you on the spot. But for a lot of the policymakers, the mental health, men's mental health, or men's health rather, has been a problem hiding in plain sight. What can policymakers do to address not only the systemic racism affecting Black men, but also the health disparities faced by members of this community?
Well, first of all, great question. Dealing with mental health and disparities between men, men and women, and Black men in particular. One of the things that's very important is outside of economics and socioeconomics is education. We have to make sure that that we educate the community, we educate the people about these different issues, right? So if it's not even a conversation, we can't even address it.
Mind if I jump in? I want to add to the education piece. I think it is very critical, and we can't underestimate education and what it means to our communities. I was just recently on a Zoom conversation with some friends of 30 plus years from high school. And one of the things we remarked was how the education we got, we went to a school called Brooklyn Tech. For those who are from New York City, it's one of the specialized schools, and there are a few others. In some other communities, they call them magnet schools. And one of the guys remarked how critical Brooklyn Tech was pretty much to saving his life. He was pretty much homeless, one of my best friends, during high school. And if it weren't for the people that he was surrounded with, us, and the support and role models, he knows for sure his life would have taken a different turn, because his brother's life took a different turn and other family members took a different turn. So that education from an early age is meaningful. It's everything. It's what's going to fix the issue of 4%, that we only have 4% of Black males are physicians. 96% of physicians are not Black males. That's a problem. And that problem doesn't get fixed in high school, junior high school. It's from very early on. And, you know, for the decision makers and the policy makers, I think that's where the focus needs to be.
Yeah, I totally agree that education is very important. Coming from St. Lucia, we were always told that education eradicates poverty. So as you all know, being a fellow Haitian yourself, that a lot of individuals in the Caribbean, they stress so much education, that we need to be educated. I was discussing with Dr. Allison, Dr. Myers recently, that usually for us Black people, we're always told like to go to school and get a career in medicine, or be a lawyer, or be a doctor, or be something, as opposed to follow your dream, which is like, oh, I love, I don't know, history. Let's study history. You know, it's never thought to uplift the Black community. And now that since we're on education, as there's some discrepancy between.
I'm sorry. Can I jump in real quick?
Sure, no problem.
So I just wanted to kind of comment on a couple of things, right? So like in terms of like money, right? Like money is deeply important in society, especially this one, right? But you know, a lot of not academics, but Black folks that we respect often talk about how like money will not save us either, right? And I think that so in that reframe, I think that it's important that we find other ways to bridge some of these gaps and create some of these safety nets, right? So like when we talk about mental health and mental health issues and concerns, right? So like there is a taboo in the community where you know, Blacks are fearful of going to really any white space, right? And I think that in that is one, a valid, but also though I think that we need to create like advocate teams, right? So like especially like the elderly Black men, right? Because oftentimes like Black men especially do not want to go to see anyone for anything for any reason, right? And oftentimes when we do, it's already past the point where we can be helped, right? So oftentimes like we've already made our mind like, if I'm going to go, I'm gonna go the way I want to, right? So I think that it's important that we check on one another, especially those kind of people like your Black friends who are always checking on everyone else, right? I think that in these times we need to find additional ways to care and be present even when we cannot be physically there, right? Also, and then in terms of actually going into therapy or hospitals, right? Like having someone that can speak to the doctors, that can speak to these people who may not be of color, and advocate for you in ways that recognize your humanity and speak to increasing your mental and physical well-being as well. Sorry.
I just want to say that was well said. That was beautiful.
Thank you.
I was just going to ask, I know that some of the members on the panel today are members of the Divine Nine. Shout out to Alpha Kappa Alpha Sorority Incorporated, by the way. But I just wanted to say, what impact and role do our Black fraternities play in helping with some of these issues we've discussed?
So,
as the member of the only fraternity here, the only Black fraternity in the world, Kappa Alpha Psi Fraternity Incorporated. No, I saw Brian put up some funny sign. I don't know what that was, but
it's all good.
And I see one of my frat brothers on here, Dr. Yaw. Big shout out to him. One thing that was is important is that, you know, again, as I was saying before, I was had technical difficulties here. Education is very important, as I was saying before, right? So we have to make sure that we educate the community. As a policymaker, also have to make sure that our young people aren't afraid to study the sciences, aren't afraid to study, to get into these different programs, aren't afraid to get into study, to get into programs that Brother Brian is in. we have to make sure that, we have to make sure that we also have a pipeline of young people of color that look like us to be able to get into these programs so that we can have these conversations. The reason why we're having this conversation is because these Black doctors are having this conversation. That's important. That's really, really important. As far as the Divine Nine and our organizations, it's very, our chapter got together to educate us Black men to talk about, hey, what's going on? And we were afraid, we were scared, we didn't know what was going on. A few of us were doctors that explained what was going on, so that on that call represented thousands of people, because we all have families and we all have to educate each other and talk about these kinds of things. Now, when it comes to men and their relationship with doctors, it doesn't matter. Socioeconomically, it doesn't really matter. Men are built a certain kind of way, right? But our job, we must, as a community, have these kinds of conversations. We don't like to talk about money. We don't like to talk about wealth. We don't like to talk about health. We don't like to talk about mental health.
Or anything.
We have to break down those barriers and talk about it, because it cannot be taboo. It's okay not to be okay. But we have to make sure that we communicate that.
Right. And also in that, right, like, I think that it's important that we know and understand that no one is okay in this moment, right? Because there's nothing in this moment that is okay, right? And before this moment, no one was okay, right? Because that moment was also heavily flawed, heavily anti-Black, and heavily separating and injuring Black men and Black women, right? So in that, no one is okay, and that is okay. But I think that it's also important that we talk about ways to create better mental health, but also like ways to exercise, ways to communicate, ways to create these different circles to not only check on and be dependent on one another, but also like advocating for like better food, right? Exercise, all of these different things that kind of resist and refuse injury and isolation, right? Oh, frets. So yeah, so as
make noise. No, we can't hear them. No.
Right, as the first fraternity of men founded on a historically Black college campus, service and the bros and the D9 really is important, because for Black people, service is really how we find joy, how we find mobility, how we find peace, restoration, renewal, spirituality, all of these things. So serving and coming together as a collective is something that's definitely beneficial and helps us teach the old and the young. Right.
So I have no signs to make. I do not belong to any fraternities. Love you guys. But I can't speak to that. But what I can say is kind of switching gears a little bit. I love the approach that I've heard, that we're talking about empowering ourselves. But at the end of the day, there is a responsibility by the majority, and that we have to hold them accountable also for the things that are in place that make it difficult for us to achieve all of these things that we're achieving. So one of the things from COVID and from the health disparities, and then we had the racial relations issues. I've been approached by some of my white colleagues who are leaders, and say, I know I need to have a conversation about this, but I don't know how to. So I think this is a moment in time and opportunity that we can't lose. We can't do it all by ourselves. There are things that are in place legally, in the society, culturally, that we will bang our heads across, against the wall to try to break down. So we need those partnerships. So we need to train others and educate others about what we're going through. The problem is we're tired. We're tired of this conversation. We're tired of these issues. I don't like to hear these statistics. I feel re-victimized every time I hear these statistics. But I think there is a moment in time, and we shouldn't let this opportunity go, to have conversation and meaningful conversation with others. And they need to understand. And I think we have a captive audience now. And I think we need to maybe get that extra energy, that extra kick to make that extra effort.
Now, Dr. Meyer and Dr. Williams, can I be a little honest though?
Sure.
So look, just talking to the brothers, talking to the men. We just talking men here now, okay?
That's why we're allowing you guys to talk, because we notice the men are taking over.
Fellas, they're allowing us to talk.
Feel free.
You know what's really sad, and now me as a policymaker that I see is that with Black men, even for us that don't die early or don't die young, we generally speaking die 10 to 20, even I'm talking about old couples, 10 to 20 years before the woman. We die early. Also, I find that, you know, even if we're working or what have you, we die, you know, we Black men in particular die not too long, generally speaking, after retirement. And a couple of things, you know, and I wonder, is this inherent with Black men? Is it nature? Is it nurture? One of the things I try to do is talk about, and this recently hit me, because I'm a man of a certain age. I'm young, but I ain't that young. I'm considered an OG.
A certain age.
And what is the role of the OG? Right? What is the role of the men of a certain age with the younger guys? Do we, right? It's very important for us to talk to the men younger than us about health, about exercising, about eating. It's very important for me to talk to my brothers. We have to speak more to each other. It's very important for the doctors to come and have this conversation. And I don't feel that we're having this conversation enough.
Absolutely correct. But we need to have access, right? First of all, you have to have access. And, you know, we see what's going on. Unfortunately, in the United States of America, your insurance is primarily tied into your employment. So that's a problem fundamentally for us, right? If we're not employed, especially now where we have 20% unemployment, so that's millions of people who just fell off from insurance, and that's a problem unto itself. And then if you do access, good luck finding a Black physician, and that's another issue, especially primary care, because again, if you know, this is like a vicious cycle. If you come out of medical school and we disproportionately have more loans, etc., you may not choose to go into primary care. And this is what we need. We need more primary care, family medicine doctors, pediatricians, OBGYN, and that's where the message is going to come from. So it's a very complicated issue. But again, to your point, I like this education, this pipeline. We have to build a pipeline. And I'm afraid COVID and education, things that people are not talking about, the disparities are we're going to look 18 months, 24 months from now. We're going to see kids who are already behind, who are going to fall more behind because they didn't have the technology, they weren't getting good instructions. And then you're going to have kids who actually get ahead. And to your point, I'm very fortunate. My kids, one goes to a private school, one is in a very good public school system. And you see the differences and so, you know, my kids may actually get ahead and others may fall behind. And that's going to be a generational problem. Some of these kids will never catch up. It's unfortunate to say that if we don't do things. And I see some cities are putting in place some resources to address this, but this isn't actually an acute problem. You know, during the summertime, 2 or 3 months, kids fall behind. So imagine 18, 24 months, what's going to happen to some of our kids. So complicated situation, but I think we need to take a look at that also.
I would have to agree with what everyone's saying. Good evening, everyone. Nanayao, Adu Sir.
Just to kind of respond to Clyde, right? You know, I think that Black men do die early. I think that you know, when you say nature versus nurture, you know, that's confusing, right? It's like anti-blackness and the worst kind of injury in the present, in the past, and in the future that is required because you're Black, right? Like that breaks the body down, right? It just does. So like that's the thing, right? But also Black men die early because we are stubborn, right? We don't communicate well. We don't. We often don't exercise, uh, and we don't always listen when we should. But also, we also choose bad partners, also, right? Like. I mean, so
Hold on. You didn't go there. You went there?
what I mean by that, what I mean by that is black men we uh, have to help our partners help us, right? In the way that we have to be honest and open with our partners about our health, about our needs, about about all of the things that scare us, bother us, haunt us, right? And oftentimes we don't do those things, and then that only makes gaps, distance, pauses, breaks between um, our relationships, right?
Yeah, but one of the things I was thinking about is that, you know, and I try this with my own people around me or what have you, is can we change the culture? Can we make a new normal, right? So we're just speaking of men, you know, a couple of us get together, we'll talk about sports all day, every day. And the people that we're talking about are fit. They're working out, they're doing stuff, right? So, and even my younger people are not doing things that, again, that we can control as far as our health, right? As far as what we eat, about our exercise, and that is not part of our normal culture. It's enough. Now, keep in mind, I think it's changing. I think we're doing it more. Like, for example, and I'll just talk examples. In my community, I live in southeastern Queens, and there aren't enough health food stores. There aren't enough, some places are what we call food deserts. There aren't enough fresh food places or what have you, and we beef about that all the time. But can we? And part of the problem too is what we go and seek. So what I ended up doing was this: is how do we incentivize better behavior? How do we incentivize better restaurants or better choices to come in? So my office put together a list of the juice places and the fresh food places or what have you. And we're gonna have a, you know, juicing competition just so people can see that, look, we can frequent these places, we can go to these places, and that we eat healthy also. And so we're trying to look at things that way and differently to try to make sure, try to show folks that, okay, we're gonna frequent health food places, and hopefully that'll get more of us to be interested to opening those places in the community. But I have a question for the doctors. Because we are, you know, we have these health disparities or what have you, business-wise, would it make good business sense to open up practices in the Black neighborhoods?
Oh, yes, absolutely. From a philosophically, yes, absolutely. Ethically, absolutely. But, you know, unfortunately, I know it's tough, but the dollars speak, right? So if you don't have the right incentives for that, doctors are not going to establish practices in those areas. So what pays the bills right now is the concept of fee for service. So you need someone to be messed up and screwed up. It's easy. It's more cost benefit for a healthcare system to cut your leg off than to do the preventative measures before you seem shocked. And and I'm sorry for delivering the message in that way, but it's a reality. Prevention is what we need. the incentives for prevention are not the same as incentives for doing a surgery. And again, this is what I'm talking about, how the laws and systematically things are built and structured that don't help us. There's this concept of what they call RVUs, relative value units. So again, a plastic surgeon is valued more for what he or she does than a primary care physician. So that's where and people don't often recognize that. So if I'm going to choose from a very capitalistic way, if I'm going to build a surgical center or a primary care facility in South Jamaica, from an purely economic place, I'm going to build a surgical center. And that's where we need your help and others like you to understand these issues and why these things happen. Sorry, Phil. Wish I had a better message.
Yeah, and just like as a mental health person, you know, I just want to say that oftentimes Black people, particularly Black men, because of structural systemic racism, right? Like Black men attaining wealth in a way that is appropriate and effective for not only us but our families. It's the pursuit of those things that often impact our mental health and our physical health in ways that they can't be undone. So therefore, I, as a mental health person, for me, I suggest that we find different ways to really find value in ourselves and amongst ourselves beyond what our body produces, right? But that's just from that perspective.
So as a policymaker, I try to figure out. Okay, doctor.
Oh, go ahead, please.
As a policymaker, one of the things that I was trying to see is, how do we discuss mental health and how do we discuss it in our communities? And Brian, I've been having a problem. And how do we make that conversation not taboo?
I mean, I think that it's always about trust. I think that it's always about someone from us speaking to us in ways that are authentic and that recognize who we are and our humanity, right? But I also think that it's about finding value in Black people, in the community, in individuals beyond a preventative care period, right? But about investing in the Black being, the Black community, the Black spaces for a invested period of time moving forward also, right? Because oftentimes either no one cares about us or they only care about us in ways that benefit them, right? So therefore, in terms of building mental health facilities, mental health conversations, and really debunking the whole taboo thing, right? I think that we also need mental health professionals who are Black, who also are able to do these other things that really speak to the wholeness of our humanity.
So I just want to jump in to talk about what you guys are speaking about. I just want to shout out 3 Black women who were very frustrated with academic medicine and very frustrated with the way things were being done. So they went ahead and they created their own businesses that specifically dedicated towards Black people and Afro-Caribbean individuals. And the first one is Dr. Tamara Moyes. She has Big Apple Urgent Care, and that's located in Brooklyn. There's also Dr. Omolara Yui Medimo. She has Melanin Medicine and Motherhood, and it's for any physician or PhD who is a mother, who's Black, and who's just frustrated about all the implicit biases and racism and everything else that goes in academic medicine. And also Dr. Uche Blackstock, who has Advancing Health Equity, and she's doing so much work around COVID-19 and the impact of COVID-19 on Black and Brown communities. And I also want to point out that a number of reasons that people, especially women, leave medicine or leave, corporate America is because they're so frustrated about the racism and everything else that goes on.
I just want to cut out to our Facebook Live. We have a couple of comments that have come up from a few people. So somebody was responding to an earlier comment about food deserts, and they said that Harvard actually did a study that debunked this concept of food deserts because pretty much people are going to eat what they want to eat regardless. The other comment that has come up in the chat is that, quote, Until we recognize Black male disenfranchisement is a generational crisis. I think the comment might have gotten cut off, but the point is they were trying to say that that's something that we need to recognize, is that we are disenfranchised as a people. And until that's acknowledged by our peers and us as a community, how is that going to propel us to get ahead? So if one of you or all of you would like to comment on that, that'd be appreciated.
Well, I mentioned the food desert comment. Now, we live in New York City, right? There are bodegas. there are corner stores. You can get, pack of Doritos and Cheetos. You can go to the supermarket and get old produce. But that's not what we talk about when we talk about food desert. I'm talking about healthy food options. I'm talking about being able to get healthy food, not preservatives. It's really a shame when, I don't know if you guys, again, I don't know where people grew up or how folk grew up, but in certain neighborhoods, you cannot get fresh foods. In certain neighborhoods, you cannot get fresh vegetables. That is real. In certain neighborhoods, you get sodas that are colored sodas or quarter waters. Now, yes, it's food, yes, but that's not what I'm talking about. In other neighborhoods, you can get fresh foods. You can get fresh options. You can get, so that's what I'm talking about. That's what I'm talking about when it comes to having fresh food options. And certain communities, when it comes to good food options, you have to travel outside the neighborhood to get good foods.
Right.
And it's just
absolutely right. And just real quick to jump on what Clyde said, right? But also though, like the question itself is a little offensive, right? Because the question itself presupposes that Black people want to die of heart failure, of heart issues, asthma, cancer, all of these things because we choose to do these things, right? When in fact we are structurally isolated, right? And the quality of foods that are often available to us, right, are of the lowest quality, right? And that's important, right? But yeah. So I just wanted to say that part, right? But yeah, I agree with you, Clyde.
I want to bridge the gap between that because I could see why the person posted that about Harvard, and I could see what we're speaking about. I think sometimes people don't know what they're consuming and the impact it has on them. I will speak for my people, Haitian descent, plantains. Plantains are revered, loved. A Haitian.
Wait. Doctor, don't say anything bad about plantains, bro.
It's coming. No, it's coming.
Don't say nothing about no banana pizza or none of that stuff. Come on now. Oh, back up.
But this is the problem. This is fundamentally the problem.
It's coming.
How many carbs are in one plantain?
Too many.
48, 50, 48, look it up. Ridiculous amount of carbs in one plantain. And we don't know that, but we eat it. This is what keeps us going for the day. But ultimately, this is diabetes, right? So to bridge the gap, we need to be educated about what we're consuming and the impact it has on our health and our mental health, etc. But yes, people will going to do what they're going to do. But I think if we educate them, we may change their mindset. One of the best things I've heard, I do some urgent care work 2 weeks ago. A woman came in and says, "Doctor, I remember you." And I said, "Oh, that's great. You made my husband stop smoking." And then I remember vividly, this guy came in, his daughter was 8 years old, was wheezing, and I smelled cigarettes on him. I turned around, I didn't ask him if he smokes. I said, "Sir, you need to stop smoking." And to your point, Brian, this is the impact that he was having on his daughter. Now, he felt that he was going outside, he was smoking, he wasn't smoking in front of her. This guy reeked of smoke. And he quit. It was the best thing you could hear as a healthcare provider. So I think we have to educate about the people what they're putting inside their bodies, and then maybe they'll make better decisions.
Right. And yeah. So thank you for that. And I do agree that there is an educational component, right? But it's not any different for Black people than it is for anyone else of any other race, right? But in that conversation, right, like it's also important to also talk about how certain communities are targeted just for a lower quality of a lot of things, right? But yeah, I agree. Thank you for that.
Yeah,
I
so
actually do have something to say to follow up in this. So I live in Brooklyn. I was in 112 zip code 11225, and it was an up and coming neighborhood. It's right next to Prospect Park. It's right next to the Brooklyn Museum, and we had equal. You could get the Caribbean food, you could get the unhealthy food, and you could get the very nice food. And then the Barclays Center came up. Then Whole Foods started coming up, and that area is 11238, I believe is the zip code for this area. And there's so much healthy food just walking around there. You could get a number of juices. There are a number of white people in the area. There's the Apple store, it's up and coming. And then because of COVID-19, and I lived in an apartment building in 11225, I had the opportunity to move into a house, but that house was in 11212. 11212 is Brownsville. And the food, the quality of food that I sometimes get, I just have to be like, oh my God.
Changes. Yep.
And the thing is that the individuals, because they've probably been raised there, they do not know like what's better quality food. Sometimes I go in the supermarket and I see like the meat and I'm just like, I cannot buy this food. There's no healthy fruits for me to eat. And so before I used to do Whole Foods. I used to just order my food on Whole Foods, but then the pandemic hit and then I could no longer order. So I had no choice but to go in the supermarket. And it's not like I'm suffering, I'm making do. But when people are not aware or not, they do not know what quality of foods, it's better. You could see like avocados for $10 for 5, but you could see Mountain Dew 10 for $5. So you would easier go for the Mountain Dew that's for $5 as opposed to the healthy food. And so it just continues to be a cycle of like poverty, a cycle of health disparities, a cycle of social determinants of health. There's so many things going on that sometimes we're not able to solve it all.
Well, this is where the policymakers have to give incentives for folks to do the right thing. So, let's be frank and blunt. Whole Foods is your whole paycheck, and we joke about it. It's not cheap. And, how can we drive people to Whole Foods? What are the incentives that the assemblyman could help with so that people are motivated by different things? But I think education, incentives, how do we help people? And I know Whole Foods, they do take, if you have food stamps and things like that, but we need to drive that. But then there's the reality of transportation, right? None of us will hesitate to get in an Uber to pay, $10, $15, $20, $30 to get somewhere. But that's an issue for some people. That's a reality. So, we can't, the stuff is complicated and we don't want to minimize it and offend folks. We have to be sensitive to really, not everyone could walk into a Whole Foods. Quite frankly, some people would be intimidated by Whole Foods.
No, it's true.
People at Whole Foods, the cash registers, they look at me and like, why are you spending all this money on this? Like, I've had one tell me that, like, they don't even consume, they work there and they won't even consume.
Yeah.
No, we have to do a lot of things, right? We have to build the airplane while we're flying in the air, right? So we have to do a lot of things, but part of what we can do is, policy and incentivizing better behavior, trying to attract all right. And here's some practical stuff that we've actually done. In our neighborhood, we have a supermarket, and we went and saw that produce wasn't up to par. We went and we went directly to them and talked about and had them make sure they properly provide better produce. We saw that there was a certain point early in March where during coronavirus they were not abiding by the social distancing process, and my people were getting in there getting sick. We shut them down. So that's important to do that at the point of, also we saw that, we saw price gouging with better foods or because it's organic, stuff is priced way high. So to incentivize people to buy the much cheaper stuff. So we have to look at all those kinds of things. but also we have to make sure that, you know, we start eating, you know, we start getting and eating healthier and going to healthier places. So we have to do all those things at the same time. And one of the people said here before, I think Brian said, this kind of education is not only unique to people of color, right? This is something that it's for everyone, right? Other folks, all folks struggle with eating better. So that's something that is not unique to us. What we have to have in our communities though is better access to be able to eat better, right? That has to be easier for us to do. Because if I can say eat better, eat better, eat better, and you gotta go down the street and all you see is Popeyes, McDonald's, Chinese food store, bodega, I mean, what you got? And so that's very important. And again, we can do it. We are, on the other side, as a people, we're eating much better, right? That is in the culture. On the other side too, we are, there's, Black Girls Run is in the culture. I don't know if there's a Black Men Run. I don't know if we do that. I'm not sure if we do that yet, but.
Let's get it going. Meet me there.
But that's in the culture, so that's happening. And then also we have to look at ourselves, like Dr. DeRusso, when he mentioned the plantains, yes, I kind of coiled, but yeah, I have to get better too, right? I have to get better, I have to improve. Not to mean that I'm gonna cut plantains out totally, but maybe less, right? Maybe just plantain chips, and how do we struggle and do that better, together?
But I think we also have to think about our historical origins. So when we were enslaved peoples, we were given the worst parts of the meat. So a lot of the foods we eat historically are because that's what we were forced to eat. And I very often will tell my patients, just because we had to eat pig's feet or the tail of the pig back in the day does not mean we still have to eat that. We can eat leaner cuts, healthier cuts of the meat. Unfortunately, a lot of our traditions come from those times. Those are our ancestors, what they were eating. So we've carried on that for generations too. So I think that also needs to be brought to the table.
But one thing I'm interested in for the doctors and for Brian, for you guys, do your parents listen to you? My sister's a doctor and my dad still doesn't want to go see a doctor, right? Is that something even in the dynamics of your own families? How are you guys able to break down those barriers within your own circles?
Not all the time.
No, it's a struggle.
It's a struggle.
It's a struggle. And there are, there are things I think Doctor was alluding to that are cultural and that we can't let go of. Like we joke in Haiti that, from a religious standpoint, yeah, we're 100%. We're 99% Catholic, but 100% Buddhism. And so there are traditions that we just cannot let go of. And the first thing we'll go for when we're sick is some potion. Now, I'm not downplaying that. There are true remedies that have benefits, but for certain things and not for all things. There's no one oil that's going to cure everything. But we have an oil in Haiti. We think it cures everything. L'huile masqueti for any of my Haitians out there. You rub it on anything you have. You just rub it on.
But it's also good for hair.
Yeah.
Castor oil and coconut oil.
I think we need to speak openly also about the cultural norms for us and when it's good, when it's not. We have to put it in context for folks and the role that it has appropriately. So a lot to do.
Yes, indeed. And this was such a great conversation, but unfortunately it's 9:05 and we kind of have to put the parents to bed. At least that's for me. So any last thoughts before we say goodbye? Just to say our next session is August 6th, and this time it will be on the impact of COVID-19 on the elderly generation. So please feel free to join in same time on August 6th. Any last words?
I would say if everyone on this Facebook, anyone who's listening, call one person and check in on them, their health, their mental health, how they're doing. Just have that conversation with one person and have that other person have a conversation also with another person. And I think that may go a ways. Or in your next Zoom call, don't just talk about sports. Maybe set up your next Zoom meeting with your family and your friends. We have a captive audience. People don't have anything else to do. So let's take this time, let's make it meaningful.
Right. And then I would just like to say, you know, to find ways to challenge yourself every day, but also to allow yourself to not be challenged or to not do a whole lot or be productive, but also find ways to love yourself better and also to love those who you love better also. Right.
Black men, you are powerful. You are great. We love you. We want to make sure that you are healthy. So please exercise, eat better, check on each other. If you need anything or what have you, you can contact my office. But we want to see you here. We need you healthy. And also the older men talk to the younger men. Younger men talk to the older men. And women, you guys hold us down. But men, keep your heads up. And mentally and emotionally, it's okay not to be okay. Talk to somebody.
Thank you very much. See you on August 6th. Good night, everyone.
Thank you.
Good night.